Ready? Okay, welcome everybody. My name is Mary Jane Burke. I'm the Marin County Superintendent of Schools, and I'm really happy to welcome you to our public health update. Let me give you a little bit of background. Just a reminder, this session will be recorded, available within about 24 hours on the Rethinking Schools website. If anyone is in need of Spanish translation, we have live translation available. And I'm going to pass this to Michelle real quick.
Bienvenidos a reunión de la comunidad de escuelas de salud pública del condado de Marin. Este webinar se transmite simultáneamente en español. Haga clic en el botón de interpretación del idioma que aparece en su pantalla si desea escuchar esto en español. Gracias a Marta Bichón, que es nuestra intérprete esta tarde. Gracias. Thank you, Mary Jane.
Thank you, Michelle. So let me give just a little bit of background. So today we're entering week 51 since the shelter-in-place order was set on March 16th. Just a reminder, our Dr. Willis was of the first in the state to close the schools of Marin County. We're on 107 days since September 8th when our students for this school year started, at least for some of them, having in-person opportunities. As of today, we've had over 1.2 million student days. And as of today, officially, 100% of our elementary schools, public, private, independent, parochial, and of our K-8 schools are open for in-person. So we're going to start by just taking a second to watch this video.
Vamos ver por negocinho para você ler, tá?
Okay. 358 days. Long time, right? A lot has happened since March 2020. School got canceled on the 3rd of the 13th of 2020. But we have some news. Guess what? What? Guess what? We're getting a dog? 3/3/2021.
What is 3/3/2021?
This year, on the 3rd of March.
Guess what?
What?
Okay. You guys, you get the drift, right? That's what's happened for children in Marin County over these last many months. So to everybody on this call and to everyone who's in our classrooms, thank you so much. And I just want to say to you, Dr. Willis, but for you and your team, there's no way that we would have been able to open our schools safely. So thanks so much. I want to give you an official introduction since sometimes I'm more casual. So remember, Dr. Matt Willis is our public health officer. He became our officer November 13th, 2012, and we are thankful for 8 years, 3 months, and 16 days of your service. He had worked at the Marin Community Clinic, MD from Temple, master's from Harvard in public health. He was worked in epidemiology, and he was an epidemiology intelligence officer. I think that's probably a very good background for you to have in this environment. You are kind, caring, compassionate, courageous. and willing to remind us each and every day that that public health is something we all have to be concerned about, worry about, and work towards. So thanks so much, Dr. Willis, and I'll pass this off to you.
Thank you, Mary Jane. Yeah, and let me also just acknowledge that, I think one of the most positive and gratifying aspects of my role as a public health officer in Marin County has been finding a kindred in the schools environment, with the Office of Education recognizing that schools are so much more than hubs of learning, but really are hubs of well-being for our children and for our community as a whole. And that's something that we had, I think, worked on together, whether it was vaccination rates or outbreaks, whatever it might have been, norovirus, measles. And so the rails were well set, I think, for us to collaborate well together, even before this real challenge of COVID-19 hit. And I just want to recognize that the success we've had, if we've had any success, it's really based on the partnership and collaboration. And I was talking to my 10-year-old who's in 5th grade at Wade Thomas School in San Anselmo this morning, and he was saying that it was exactly 1 year ago that Chitty Chitty Bang Bang, the production was staged, was one of the last kind of group productions that they actually had before we closed things down. And I could not imagine that it was only 1 year. It really felt like it was so much longer ago than what, but really what a remarkable year it's been. And we are, I think, in a good place coming out of that year to nearly fully reopen in Marin County. So thanks. I have slides. Should I share them for my own self, or do you want to? I'll share my screen.
Okay, great. Thanks.
So I'm just going to go through an update of where we are as a community now, and then we'll talk. I think what's on everyone's mind now particularly is our vaccine distribution plan, especially how it relates to our educators, and we have some exciting news to share there. Can you see my slides?
Yes.
So this is just some screenshots of our public-facing dashboard. Anyone is invited to browse this at coronavirus.marinhhs.org. Almost 11,000 cases so far. The total number of active cases in Marin is 282. That number continues to decline. That's the number of people who have been diagnosed in the last 2 weeks, with over 360,000 tests now completed. This is our epidemic curve. It shows that we had 3 essential waves. That first wave, when we first shut things down, as Mary Jane said, among the first counties to close our schools. At that time, there was so much that was unknown about COVID-19, how it was transmitted, how we could control it. If you remember back then, it was before we were even recognizing the value of mask wearing, and we chose to err on the side of caution at that stage and really learn as much as we could, and then apply that learning to our strategy. And that has really been the way we've approached this pandemic all along, and it has paid off, I think, in our results. The second peak in July and August, characterized by real disproportionate impact in our Latinx community. About 80% of the cases during that particular surge was in our Latinx community. And then in the fall into winter spike, starting in the end of October, fueled by Thanksgiving, fueled by Christmas, fueled by New Year's, peaked about mid-January. And now we are seeing really progressive declines in cases since then. This is the corresponding impact in terms of our hospitalizations and ICU. This was, during that peak, as we were seeing in December and January. This became one of the most important organizers of our strategy, was really to protect our hospital resources, because we were seeing such dramatic increases in cases and in parts of the state, truly overwhelming the healthcare infrastructure. And so we had, if you remember, entered into the stay-at-home order under the governor because of projected limitations on our ICU bed capacity. We've moved now from that status, from the stay-at-home order. We went into the purple status and now have moved into the red status, and we'll talk more about that. but our hospitalization rates are as low as they've been in about the last 3 months. This is a tool I just want to call to your attention. This is a new functionality on our public-facing website. This is, anyone can look at their own community. This is a interactive tool with drop-down menus that you can search by city, census tract, or zip code to look at the total number, the total population, the number of cases over time, the number of cases in the past 14 days, with some graphics that reflect that. And this shows the 2 peaks that we saw in this as a screenshot of Center Fell. So it shows the surge in cases that we saw in Center Fell in July and August, and then in the winter time. So here we are now in the red tier. We are among that 4% or so of the entire state of California that is not in the purple tier. We are, you would move forward last week into the red tier because of our lower percent positivity compared to other counties. And this is reflected here on the far right. What you show is that lowest HPR quartile. And the reason I'm sharing this is that I think it's an important, that this is really because we have been focusing on our low income communities and really making sure that we're targeting those communities both for the outbreak mitigation, but also for testing, and making sure that there's adequate resources to make sure that the disproportionate impact in those communities is mitigated as well as it can be. On the right there, what you see is that our percent positivity, that is the proportion of people who are tested who are actually infected in our lowest income communities in Marin County, is about 3%. It is on that basis that the state was able to advance us from the purple tier into the red tier. The state looks at both case numbers and percent positivity in your lowest income communities. And so it validates the approach that we've taken in this county to really focus on those hardest hit places. So this is what it means for us to be in the red tier. Our restaurants are now able to be open at 25% capacity. Retail indoor capacity is opened. Churches and synagogues, et cetera, mosques are able to be open at 25%. Weddings and funerals are able to actually occur indoors at 25% capacity. We've opened gyms, fitness studios at 10% capacity, movie theaters at 25% indoors. And most importantly, is that middle and high schools that had not yet reopened, know that about 10% of our schools that had not yet reopened in Marin County can now reopen to in-person learning because we are in the red tier. Now I'm going to pivot to our vaccine distribution plan. This is the latest from our web. This is visible to the public on the website. It shows every day the number of new people who have been vaccinated. It shows we've vaccinated about 59,000 individuals in Marin County with at least 1 dose. That's about 23% of our total population. And if we actually, in our total population, about 260,000. If we remove about 50,000 people who are age 17 or less, because they're not currently even eligible for the vaccine based on the vaccines that have been approved, it's more like 200,000. So that, by that metric, almost, about 30% of our population who are eligible for the vaccine have actually been vaccinated. So we're making a lot of progress with regards to vaccine, and that's confirmed by just looking at the numbers for Marin. Marin has the second highest vaccination rates in the state after Napa County. And then, as you know, we have been really focusing our vaccine distribution on our oldest residents. We have among the highest proportion of residents that have been prioritized for the based on age. We've been choosing to prioritize age, obviously, based on the fact that that's a group that is at highest risk for severe illness and death. For anyone above age 75 who was infected with COVID-19 in Marin County, the risk of death was about 15%, or about 1 in 7 individuals passed. That was one of the primary reasons why we thought it was so important to really stay focused on that cohort, to really encourage as much coverage as possible. A vaccine offered to someone age 75 or above in Marin County is 330 times more likely to save a life than a vaccine offered to someone under age 50. And this shows how much progress we've made in vaccinating our older residents. Now there are only about 4,000 total residents in Marin County, age 75 plus, who have not been vaccinated. We vaccinated over 80% of our oldest residents, and we vaccinated about 70% of our residents age 65 or greater. If you think about the fact that 92% of our deaths were among those age 65 or greater, like 9 out of 10 deaths among people age 65 or greater. The fact that we have vaccinated more than 2/3 of that group is a real game changer as far as I'm concerned from a public health standpoint, because that means that for the duration of our pandemic experience, we have now categorically protected, relatively effectively protected those that are really at highest risk of the most severe outcomes. And I'm feeling optimistic about our trajectory here, our path. We are every day vaccinating more and more. And this is a graphic that shows the ratio of people who are vaccinated each day compared to the people that are infected each day. And what this shows is, like, if you look at the 26th of February, almost 400 more times people were vaccinated than were infected, if you look at test rates. So every day that passes, the more people who are protected relative to the number of people who are at risk of bad outcomes from having been infected or infectious to others, every day that ratio increases. More and more people are getting vaccinated and fewer people are getting infected. And that's the recipe for the eventual resolution of the pandemic when you have a vaccine that's available, that's safe and effective. So we are on that path. This is some of our mortality projections. If we vaccinated 70% age 65 with a 95% effective vaccine and 92% of the deaths come from that group, we would expect that our death rates are projected to drop by more than 1/2 just in the month of February and will continue to decline. And in fact, our numbers validate that. Our death rate in the month of February compared to January is less than 1/2. So these are the planned vaccinations for the week of March 1st. We have 17,000 total doses coming in. 10,000 of those will be allocated for first doses, so that's new people who are able to be vaccinated. That's about 4% of our population. I'll just briefly go over kind of where the main vaccines are occurring. There's the Marin Center, that's the public health set pod that's been operating from the very beginning. 5,000 doses over the course of the week. We have sector-specific days that we'll talk more about. One day dedicated to food service, another day dedicated to childcare, another day, a Super Saturday dedicated to educators. And then Marin Health will have 1,000 doses. The canal area of Santa Fe, we have a pod here in the canal area of the Kerner campus. We'll do about 1,200 doses. The ferry terminal, the curative site there will be about 3,000. Kaiser's increasing their access. They have more allocation, about 5,000 doses there. We have mobile units traveling throughout the county to vaccinate people who are hard to reach, about 600 doses through that. Actually, that's more like 1,000. We just increased the allocation there. And then our pharmacies are also now able to offer CVS, Walgreens, Costco, Safeway, Rite Aid are all offering pharmacies, much like they do for flu, for COVID-19. And they're collectively about 2,000 doses. So that's all very good news in terms of the general vaccine distribution. We'll talk more specifically about how we're vaccinating our educators in a minute. Just wanted to share with you the schools dashboard. So we've added, you may have seen this is also on the website. We've added a couple elements I want to call to your attention there on the left. We're now including the total number of student days on the dashboard. And that shows what Mary Jane opened with, which we've had 1,166,025 total student days accumulated since September 8th, when we began reopening schools in Marin County, when we were in the purple tier. In all of those experiences, all that combined risk, if you will, of students actually being in person in classrooms in Marin County, we've had a total of 11 suspected in-school transmissions. 6 student to student, 3 adult to adult, 2 adult to student, and no occasions of any student to adult based transmission. And this is based on rigorous investigation of cases among students or staff who are involved in communities with in-person learning. Our case investigators will go and work with the school-based liaisons to determine where the transmission might have occurred with a very, sort of comprehensive case investigation. it goes beyond the normal case investigation because we know it's occurring in a risky setting in a school. And so what we've seen here has been validated by the CDC and across the nation in terms of other experiences where the risk of transmission within schools is limited as long as the policies and procedures are in place that we have developed with Marin County Office of Education. The 30-point plan that you're all familiar with really is the way in which we're preventing transmission in schools.
Matt, if you don't mind, there's a question in the chat that's asking if that chart is just public schools, and no, that chart represents public, private, independent, and parochial schools in our county.
That's right. That's all schools. And it shows that 91.4% of schools are open. So we're talking about that last 8.6%. So let's get into the vaccinating our educators. And that's you all. So our goal is to have all school staff fully vaccinated before spring break. That was what we agreed to as made a lot of sense as our shared goal with Marin County Office of Education and Public Health. Marin Public Health has formed a coalition with our major healthcare providers, Sutter, Marin Health, and Kaiser. And fortunate, again, it's just an example of very strong partnership on behalf of our community health and well-being. And they're totally in. Our three hospitals are completely committed to joining with us to make sure that our educators are vaccinated. So to that end, we have established these Saturday super pods, or super Saturdays for educators. Right now we're working with the priority 1 and 2 in-person staff. Those are educators that are been on the front lines. We've actually vaccinated the majority in priority 1. Priority 2 are other educators who are involved in-person learning, and that number continues to grow, fortunately, as more schools reopen and they are placed into that priority 2. Our first dose dates in the Saturday super pods will be this coming Saturday, March 6th, with 2,000 doses. And that 2,000 doses, just so you know, comes from allocations from Kaiser is going to be contributing doses, Marin County Public Health is contributing doses, Marin Health is contributing doses. And that's how we combine forces. And in addition to offering doses, they are offering staff. So we're going to have 22 lanes operating 8 hours. And that's how we're able to get to that many people in a day. And that's going to be the highest number of people we've ever vaccinated in one day at the Marin Super Pod there at the Marin Center. And then we'll be the following Saturday, another, we think 2,000 doses. It will partly depend on how many people we need to vaccinate who are remaining in those tiers, in those priority groups. We can go up to probably 2,000 again if we need to the following Saturday. And then the second dose dates will be the corresponding delay for Pfizer. So it's March 27th and April 3rd. So 4 Saturdays set aside, super Saturdays for our educators, and Marin will be done by April 3rd. And then those who are vaccinated on April 3rd by April 10th or so, full immunity. It takes about a week after that second dose. So our school districts are being asked to supply rosters based on the allocations to MCOE. Mary Jane, do you want to talk more about that particular process, or should we get back to that in the question and answers?
I think we can get back to it in the question.
Okay, great. Yeah, and then just, one of the real challenges of having these sorts of events and having a limited supply of vaccines where we're having to prioritize certain groups is that you have to gatekeep. And so we have to be able to say, okay, this day is dedicated to this group, and then this day is dedicated to this group, whether it's healthcare workers, teachers, or other essential workers. What we found is that when the links go out, so we send the links out to those people who qualify in those groups, and then on the registration portal, there's a way to do a test that you belong to that group. That way you're able to get an appointment and come in and get vaccinated. What ends up happening too frequently is that those links end up getting shared either on social media or outwards, or someone, whether it's an innocent or not so innocent act of sharing it, it ends up being the appointment, the days will fill up very quickly with people who are not intended to be the recipients of vaccines if it gets shared widely. And that interferes with our progression, and it'll actually interfere with making sure that people who need the vaccine most get it first. So if we can just all agree through a social contract that we not share those links when they come, because there is no other structural way to actually prevent people from signing up for vaccines. At the end of the day, there is an honor system here, and we really need to adhere to that. So then these are other options. So that that's the main way that I just described. The Super Saturdays, where the majority of our educators will be vaccinated in Marin County. But importantly, we also want to be opportunistic about this. And if you have other options, please take advantage of them. My Turn, mentioned here. Everyone is encouraged to sign up for My Turn. That's the new state platform that will be used for ongoing for appointments in sites like the FEMA site, the one in Alameda County, the Moscone Center in San Francisco, some of these large scale sites that are available to people across the region. There's also a one-use accessibility code that's being allocated by the state. The governor has been prioritizing educators moving forward, and to that end has offered each county a certain number of protected slots that are actually protected through a code that individuals would use to be able to register for protected slots at My Turn sites, including sites outside of Marin County. And Marin County Office of Education did receive some number of codes to be able to allocate to our educators. In addition, Costco, Walgreens, CVS, Curative, and other sites have been established for essential workers, and you and anyone in the education sector qualifies and can get appointments at those sites. The Curative Life Ferry drive-through is also open to educators, and you can visit our website. The link is there for the most up-to-date information in terms of where the sites are. And again, if you're able to get a vaccination through another option, it's helpful to let the school or the school district know so that you're removed from the SuperPod roster, because it's helpful for us when we do those Super Saturdays to have a clean list of everyone who's going to come in, so we can verify who they are, cross them off the list, and register that they've been vaccinated. And when people who have been, and especially if you have an appointment, we don't want to have people who have appointments at the SuperPod on Saturday, if they've been vaccinated, say Wednesday elsewhere because they were able to get a vaccine. We really want to make sure that you let someone know so we can take you off the list, because otherwise you're taking an appointment slot that might be available for someone else. I'm just going to end with a couple non-vaccination related things. One is the variants. So obviously everyone is concerned as we start seeing more mutations, as would be expected with a virus like this, where millions upon millions across the globe have been infected. There's always a certain rate of mutations that occur. Just by chance, some of those mutations end up actually changing the characteristic or the behavior of the virus. What we're concerned about with the behavior of the virus is three things. The first is whether or not it changes the how contagious it is. The second is whether it changes how virulent it is, whether it changes how deadly it might be. And the third is whether or not it changes how effective the vaccine is against it. Right now, there are variants that are circulating across the globe that actually have all three of those characteristics. The South African variant, for example, the vaccine doesn't work as well against it. It may be more contagious, and it may be more virulent. And so those are the concerns that we have as we observe this globally. There's a variant that's more common in the United States, especially in California, the California variant B1429. It seems to be increasing in prevalence across the region. And we are obviously concerned that if that variant has different behavior, that it could be get spread more rapidly. It doesn't seem to actually be very different than the native strain. And the best evidence for that I can see is that when we look at the population, while this variant has become more common, we've also seen just dramatic drops in cases, hospitalizations, and deaths. And so it doesn't seem to be behaving differently, although in some of the laboratory studies, it may be slightly more infectious than some of the other strains. So this is something that we're watching very carefully. We're sequencing samples in Marin County. 3 to 4% of the samples is our goal to have sequenced. The state is opening more laboratories to do the sequencing to test for the the emergence of variants. The South African variant I already mentioned is not common. In the United States, we've only seen two or three cases of that variant strain in the Bay Area. And the UK variant, I think, is another variant of concern. That's a variant that's more common in the United States now, and we'll probably see more and more of that strain because it is clearly associated with more infectivity. The good news is that variant responds really well to the vaccines we currently have. And if we vaccinated, the majority of our older residents against, the most severe outcomes of severe illness and death, then I think we can rest assured that even if we start seeing more variants, it won't necessarily translate into more deaths. At the end of the day, the most important, I think, take home with the variants is that the strategies that were used to contain this for the past year are the same strategies we would use to protect ourselves in whatever variant might emerge, because at the end of the day, this is a respiratory virus that's exchanged through aerosol and droplets, and our policies, procedures, and behaviors are designed to prevent that from occurring. And so we just need to double down on those things that we do best, and we will continue to monitor the data. And if we do see increases in cases, it may well be because the more contagious variants are becoming more prevalent, and we'll have to adapt to that in terms of our policies the way we have at every stage along the way. That's one thing we've done well in Marin, is to be adaptive in our response, and be humble about what we know and what we don't know, and we'll continue to monitor that as we move forward. Johnson & Johnson vaccine, another piece of good news. It's a one-dose vaccine. We're expecting it maybe by the end of this week or early next week, as an example of how flexible and adaptive we might be. None of the health officers in the region know when we might be getting this dose. It's been approved by, or this product has been approved or authorized by the FDA. States saying we might get it as late as this, as early as the end of this week. We have no idea how many doses we might get. The state's getting 380,000. Proportionally, that would be about 2,000 doses from Marin. So we're ready. If we have this, that it'll just open up more options for us. The use case for the Johnson & Johnson will be mobile outreach. Our mobile teams can use it because it's easier to just offer that one dose and not have to go back. Hard to reach populations, our incarcerated populations, people being discharged from the hospital, our homeless populations. These are the communities that would be focusing the Johnson & Johnson vaccine on. And then people who would prefer or just prefer the convenience of a one-dose regimen versus two. It is 85% effective at preventing severe illness and death, which is lower than the effectiveness of the Pfizer and Moderna product, but not so much so that it's not a huge asset to us to have this vaccine as part of our tool chest, especially because of the benefit of being a one-dose regimen. So I've already mentioned most of these points. This is just that, right now, our strategy is really still committed to staying vigilant around this. There's a lot of good news in terms of moving into the red tier and lower case rates, increased vaccination rates, but it is certainly way too early for us to let down our guard, especially as we seek to reopen schools. We've been clear on this point all the way along that the community has to do its part to allow us to reopen schools by doing everything we can to limit transmission at the community level. And those are things that we need to continue to do. We've learned that schools are not a driver of community transmission in Marin County. I think we've seen that as we've moved. We've had the most dramatic reductions in case rates while we have been having some of the most accelerated reopenings of schools. And the reason is that schools provide stable, structured, and supervised and supportive environments relative to the alternative of less structured and more haphazard interactions between families and between children when schools are closed, especially in communities where you cannot afford necessarily have one parent stay home for that child to make sure that they're in a supervised environment throughout the day. And then just the universal precautions. We're taking universal precautions. Mary Jane's been very clear on this point along. If we assume that everyone that you interact with might be infected, that's a really good operating assumption to protect yourselves. And that's been the principle that we've applied to our 30-point guidance document. which we have made some modifications to along the way. But I've also been really impressed at how much we haven't needed to change. That was a document that we developed in June. And it has really been relatively preserved. Yes, we made some adaptations to it, but it was really right from the start. And I think that was part of the success that we had. And then the fact that people were actually vigilant in following the guidance is one thing. To develop the guidance is another thing to adhere to it. And then these are some of the resources that everyone can look to learn more about our process and keep up to date with our information. Thank you.
Okay, great. Dr. Willis, how about if we go to a few questions here? And let me start with, I'm going to go to the questions, but here's a question about that people are excited for teachers to get vaccinated. Do you see opportunity for school volunteers to be able to join those that will get vaccinated?
I mean, certainly having school volunteers as part of the vaccine operations is excellent. I mean, one of the reasons we're able to offer these super pods, I should have mentioned that, is that it's not just the staff from the hospitals that are coming together, but it's our educators. I think we have up to 50 volunteers at each of those Super Saturdays from the education community through Marin County Office of Education that make it so possible. And I have to say, the volunteers from our education sector are the most prized volunteers. They are. Everyone knows that's if you want someone who knows how to manage people, invite our volunteer educators to come help with the pod. So yes, we do want volunteers. And is the question whether or not volunteers will be vaccinated, Mary Jane?
Yeah, vaccinated and able to go back into the classrooms.
Oh, I'm sorry. I thought you were talking about the pods. Well, it's a point I want to make anyway. But yes, so we want to make sure that right now we're trying to optimize classroom size. The number of students that can be in the given classroom without having to go to less than 4 feet. So I think it's too early for us to say that we want to invite adult volunteers into the classroom the way we had before. I think we need to take this in stages. I think that's a hope that we would have. But again, I think from a dedensification standpoint, making that as a stepwise, we're not ready to say that that's a strategy yet. If the question is to whether classrooms would look like they looked like before in terms of volunteers, the answer is not yet.
So Matt, there's several questions about distancing, the spacing between students. And as you know, there's been some varied details that we've received about actual distancing, the 4 foot, 6 foot distance. And so the question is, what's your guidance about spacing? And just in particular, I think for everyone, just as a reminder that our 30-point plan that was issued June 18th of 2020 allowed for 4 to 6 feet distancing at that time, as long as people were taking into account other issues. Matt, is there anything that you'd like to add to that?
Yeah, we're looking for 6 feet. We've had no cases of student to adult transmission, and the 6 feet distance from students to adults is one way to accomplish that. 4 feet between students. There are some schools that are going with the World Health Organization 3 feet principle outside of Marin. We're sticking with 4 feet. We think with 4 feet we can balance that. The number of children that can be in the classroom together with the distance necessary. The fact is that with facial covering and ventilation, 4 feet seems to be, even from the CDC and from other evidence that's accumulating across the state, a safe practice. I think ventilation is another really important key here. We're making sure that there's enough air exchanges. So it's hard to separate the distance from the context. And really the distance is a piece of the constellation of practices. if students are also covering their faces, if they're frequently hand washing, if they're staying home when they're symptomatic, following those other protocols, and there's adequate ventilation, our standard remains 4 to 6 feet for students and 6 feet for adults.
And just as a reminder, for many of our classes, preschool classes, classes with young children, some of our high need special ed students, it is not possible to keep that kind of distance. You can't keep a 2-foot distance, right? So that's been part, I think, of all of the sort of modifications that people have been making to keep kids back in our classrooms.
Yeah, and this is, I'm talking about the way that the room is arranged.
Right.
In terms of desk spacing, but I think we also know that that's not practically possible in the course of the behavior of some of our youngest students over the course of the day.
Matt, can you talk about when will coaches, anything you can say about sports? Let's start there. And also, when will coaches get to be vaccinated? And then while you're at it, how about people involved with safe routes to schools?
Yeah, okay, so the state just completed their set of recommendations that we're now adapting to for Marin. I've been spending the morning on that document actually, and I think it may have been already sent out. The Marin County Athletic Trainers has set up a task force and has worked with MCAL on a set of guidelines that Marin County Public Health has approved and is coming out. Some of the principles there. One is that it's really following the state recommendations. So the state has very clear recommendations now, and we are, as much as possible, following the states and referring to what they endorse. Some key points that I think are differences. We are allowing play for students in adjacent counties that are in the same tier, for interscholastic competition, for sports that are allowed within that tier. So red tier sports that are allowed in San Francisco or Contra Costa County are now allowed. San Francisco will be moving into the red tier, as Contra Costa will be also probably tomorrow. Sonoma County is not there yet. You'll see, the face covering, mandatory mask wearing, except for very limited situations where there's active competition occurring and it's not feasible to wear face covering and 6 feet distancing can be achieved, is one exception to the face covering. The other is that it's strongly encouraged that every coach only be involved with one team. But if it's not possible to achieve that standard, that's now moved from an order to a recommendation in the state, and we're following that in Marin County as well. And there's a few other changes that will be reflected in the guidance that's coming out today. Yes, coaches are able to be vaccinated as part of the education sector.
So there's several questions related to the vaccinations and the priority list. So let me try to review that quickly. We have 4 priorities. Priority 1 is the first group that were primarily vaccinated on January 17th. What it took to qualify was number 1, to be in person. So anybody had to be in person. Special day class teachers, paraprofessionals that support them, one-to-one paraprofessionals, custodians, food service workers, bus drivers, and people over 65. So that gives you the sense. And at that time, we were able to get to the majority of people in that category who actually wanted to be vaccinated. So just a reminder, like other sectors, what we're seeing is at this point, about 25% or so who are being offered vaccinations are not yet ready to get them. So priority 2, which is the area that we're in now, is anyone else who's working in person. And we are defining that to be that they will be in person by April 1st. And that provides for the flexibility of what's happening right now. As many of you are aware, today, Novato High School, San Marin's High School began to open with their 9th and 10th grade. Their 11th and 12th will begin next week. Tamalpais High School District will begin in person tomorrow. The San Rafael District will be soon coming forward mid-March. I think by mid-March, 100% of the schools, all schools in Marin County will be offering some in-person opportunities. So just to give you a sense, so that's where we are now. The number, what used to be our priority 3 has significantly diminished given all of the in-person activity that's now happening. We used to have about 1,400 people in that priority 3 category, but they're now moved up to priority 2 in that they'll be teaching in person. And someone was asking about priority 4, ancillary. That number is quite small in our overall database, somewhere around 300 people total. So where we are is that the school districts essentially, or private independent parochial schools, I prioritize their staff based on those particular priorities that I mentioned. And currently what they're doing is going through, catching up on any priority 1s that they may have missed, as well as their priority 2s. So the information that was provided this morning to everyone essentially told them how many slots they have to begin to fill the pod that's scheduled for March 6th. As Dr. Willis mentioned, there are many more available opportunities for people to secure vaccination. And so what we're trying to do is get the best data we can to ensure that anybody who already has a vaccination or has an appointment for a vaccination, that we will consider them taken care of so that we can get those pods filled with the people who need the vaccination. I will tell you that a lot of people are sort of responding to that, but we'll get more information. And someone asked if there were any available slots because people don't sign up. We will definitely be redistributing any slots that become available. And also there were a few questions about how are we checking this, because what happens is, I think Dr. Willis described, and you are, I think, more than aware, is that you can end up on Nextdoor or Facebook and see a link that would take you to one of the clinics. So we are able now to cross-check who actually has an appointment with those people that the names have been submitted by the districts. We're feeling very, just for everybody to know, very, very, very positive about the goal that everyone will have both dose 1 and dose 2 prior to the spring recess. So we should be very excited about where we are with this process. And Dr. Willis, thanks to you for being the first to prioritize in the state, educators, as evidenced by our January 17th, our first pod. And then thanks to the collaboration of our partners from Sutter, Marin Health, Kaiser Permanente, for pooling the resource so that we can efficiently get everybody vaccinated. Someone here mentioned, Dr. Willis, that it seems like you might think this meeting is for school staff rather than a community town hall. And just want to let you all know that actually this is intended to be primarily for school people, even though a lot of people get invited. They're all school related. And Dr. Willis does do town halls for the general public as well. All right, I'm just trying to see if there's any other.
Yeah, and I can, if that's the Board of Supervisors meeting on Tuesday mornings. I do offer a just a general update to the community every week. They generally start at 9 o'clock, and it's the first item, and it's usually about 10 minutes, and then 10 or 15 minutes of questions if you want to participate there for more general information, not just for the schools. And then also we do every couple of weeks we do a general town hall.
Mm-hmm. There's a question about the 30-point plan and if we are updating it with the CDC guidelines, and the answer is yes. There's a draft that's being worked on right now related to a couple of areas. In addition, we are also working on the guidance related to transportation, how many students would be allowed to be on a bus. So that's also being looked at, oh, here's someone that's correcting. Marin was not first about prioritizing educators before Marin did. Well, maybe we weren't first, but having had 25% of our staff vaccinated in January would definitely be, I think, the first that actually offered direct vaccination.
Yeah, that's been a source of confusion, and it's just another, to me, it was another sign of the need to be flexible and adaptable in our strategy. We've been really challenged by not having consistency in our allocations or even visibility or predictability on how much doses we were going to receive. And so when we were seeing that we were anticipating more doses coming down, we started into our teachers and our childcare workers, and had done that priority group almost entirely in a single, Super Saturday-like event. And then our allocation almost dried up. We had 0 doses allocated to us in 1 week. And so that's where we had to just really switch our strategy from occupation-based risk to pure age-based risk, and really spent a few weeks vaccinating our 75 plus, then our 65 plus, and then reopening to groups that are based on occupation. So there was I think we were, if not the first, among the very first in terms of that very first week, where we got about 25% of our educators at level 1, and then had a hiatus, and now we're back online, and we're going to move as quickly as we can to get everybody.
There, just as a reminder to educators, a question came in about the timing of this particular meeting. That, as a reminder, on Thursday, so the Thursday after the first Thursday of the month, we also are holding another meeting that's really focused for our teachers and staff that are working in person, and that's this Thursday at 4 o'clock. And we did that last month as well. So we'll continue to provide that opportunity that will be focused on teachers. Matt, I'm not sure. Is anybody else seeing any question that I'm not seeing right now? Or Dr. Willis, are you seeing anything? Oh, but
I see some raised hands.
okay. So Betty Latuanio, why don't you go ahead? Can somebody unmute her?
Hey, Mary Jane, while we're waiting, one of the questions that's come up several times is when will elementary schools be able to be back in full time?
That will definitely depend. Remember, nothing about this effort has been cookie cutter. So just to remind everyone that in September, we saw some of our schools open for some in person. For example, Sausalito Marin City was one of the first to open, I think September 14th. We will definitely be seeing, I think, a phased in approach during this next period of time. So it has to do with what's happening at that particular school, what the conversations are about what their phase-in plan was, what their agreements have been with staff and with families. So I'm not exactly sure, there's no answer to say, X date. I do know that there are several districts that are in fact looking at bringing students back after the spring recess for 5 days a week, I think full days. So there's some districts looking at that, but that would not apply to all of the districts, at all. And people have been, phasing in related to this. And I wanted to say that's been very important to the success that we have. If you look around in other communities where they have none of their students in person, in a whole county, that perhaps the strategies that we have used here in Marin have been the best. Have a good plan, work closely with public health, keep safety first and foremost, and allow the local community to come up with what is the best opportunity for them. I do want you to know, though, that we do have a goal that our students will be back in their classrooms full time as soon as possible.
Can I just address the fall question? I went through the pace of our vaccine distribution plan. To me, the vaccine is, with such an effective vaccine, a 95% effective vaccine, our trajectory is to be completed, unless we have a diminishment of our supply, by the end of June in Marin County. And then, children may be authorized to be vaccinated, and we could spend July on children if that comes at that time. So when we're talking about fall, August, September, we're talking about a community that has been largely vaccinated. My prediction is that we will be able to open schools to full-time learning in the fall. We may need to continue to, and will need to continue to practice some of those practices that we've used so effectively over the course of this year, including masks. We may need to, unfortunately, may need to continue to cover our faces, depending on what's happening elsewhere, depending on the variants and other factors. But right now, it's looking like fall is going to be, coming back into full-time classroom-based learning for schools across the county.
There's a couple of questions about how much time students are in school. If you have a minute to go to the Rethinking Schools website, we have now established a chart that will give you the school district and the amount of time that students are actually in person. The one thing that I'll tell you is that students are in fact able to go to school in person, at least walking through the door 2 days a week.
Can't hear you.
Oh, you muted, Mary Jane, mid-sentence. Well, while Mary Jane's coming off mute, I just got a communication from Kaiser that Kaiser is now vaccinating teachers at their site in Terra Lunda. So I think that we will be moving through I'm more and more confident as I see more and more partners vaccinating educators that we'll achieve that goal of full coverage by before spring break.
Dr. Willis, can you hear me?
Yes.
Dr. Willis, this is Betty Latuanio. I had asked a question, and while Mary Jane is setting up, I wanted to thank you and Mary Jane for doing the town hall. I represent Dedication to Special Education, and we focus on kids with disabilities. Governor Newsom announced on February that on March 15th, people with disabilities 16 to 64 could get vaccinated. Our students with Marin County Office of Education and the districts in Marin County from 16 to 22 have parents that are ready to start the process, get the doctor's letters. What's unclear, and we'd love some guidance from you, and it doesn't have to be here, but at some point too, how do parents go? Are they going to go through Marin Public Health? Are we going to be doing it at Larkspur Curative drive-through? Are we going to be going to the Marin community clinics? Many have autism, many have physical needs. So some direction on how to have our most vulnerable students vaccinated would be helpful. Thank you.
Great. I can offer very brief. The default is going to be if they have a clear medical provider that's offering vaccines, like their Kaiser connected or already connected with community clinics, and that's where they'll get vaccinated. If they don't fall into one of those clear categories, we will cover them through an attestation through the letter from the provider.
And what would the location be? Any of the locations?
Any of the locations.
Great. Thank you.
Yeah. It looks like we're coming up on our time.
Hey, so sorry, I'm going to be Ken Lippy for a minute here. I'm sure there's many people on this call that would love nothing better for me to be muted. So, but anyway, that's what happened. So back to everybody here. Reminder, there'll be a session on Friday, a Thursday, 4 o'clock for teachers, classified staff to get any more information Thank you all for everything that you've been doing. We appreciate it very, very much and look forward to the next conversation. Congratulations to all of you for the good work. We have much to be proud of to have so many of our students have that opportunity that we saw at the beginning of that video. So thank you so much and look forward to talking again. Thank you, Dr. Willis.